Hi, I am Dr. Sunil Eshwar, lead consultant, obstetric gynecology, infertility specialist and laparoscopic surgeon at Aster RV Hospital, JP Nagar, Bangalore. Semen analysis is the most basic investigation which we do to investigate for infertility in the male. Some of the parameters which we look in this semen analysis is the count, motility and morphology. But many a times it is a shocking news to say or reveal to the patient that there is no sperm in the semen given by the male partner. So this is termed as azospermia or no sperm or zero sperms. Azoospermia means no sperm in the semen provided by the male partner. It doesn't mean that there is no sperm produced in the testis or in that particular male. So azoospermia we generally divide into two categories. One is obstructive azoospermia, another one is non-obstructive azoospermia. Obstructive azoospermia, as we know, the sperms are produced in the testis and from there they have to travel through a tube called as vas deferens to the penis. Sometimes this vas deferens can be blocked either because of infection or surgery or some of the condition where it's genetically determined where there is an absence of this vas deferens. Non-obstructive azoospermia again are two types, where in one type the testis is not producing the sperms because of testicular failure. That means it is not capable of producing the sperms. In another condition where the testis is not producing sperm because it is not getting enough signals to produce the sperms. The most important question now is, can this male with the result of azoospermia have a biological child of his own? As we have divided the azoospermia into three different categories now: the obstructive, the testicular failure and a testis which is not producing sperms because of lack of signals. Most of the azoospermia is because of obstructive azoospermia. That means there is some block. This patient can undergo a procedure called as microsurgical repair of the vas deferens if there is a minute block, or they can undergo a procedure called as PISA, that is percutaneous epididymal sperm aspiration, and check whether there is good amount of sperm being produced in the testis and whether these sperms can be used for IVF ICSI. If so, we can do this procedure of PISA, store the semen sample or freeze the sperms and use it for the procedure called as IVF ICSI and get a proper, normal, healthy biological child of his own. Now, in the other cause of non-obstructive azoospermia, when there is a lack of signals, we can treat this condition by giving certain injections and make the testis produce the sperms. This is a condition where over a period of time following this injection, the sperm count becomes normal and they can naturally try to conceive. Whereas the most difficult condition for us as a reproductive medicine consultant and the couple is the testicular failure, where the testis has already failed, where its cells are degenerated, where there is no capacity for the testis to form any sperms. In this situation, unfortunately, they will have to try donor sperms. Or, as there are certain researches coming up where we can use the other germ cells to create new sperms and use it. Till that technology is available, we are unfortunately have to counsel them to try for donor sperms. So when you talk about azoospermia, 90% of our azoospermia patients can still conceive and have their own healthy biological child. It's only this 5 to 10% of patients who have a testicular failure where we may not be able to help them to have their own biological child. So, with the result of azoospermia is not the end of the road. Please come to Aster RV Hospital, JP Nagar, have a consultation with our team of reproductive medicine and urologists and andrologists here to realize your dream of your own healthy biological child.